Hello and welcome to Pregnancy Info. Today we are going to discuss the 20 causes of breech baby in the pregnancy. About 3 to 4% of all pregnancies will result in the baby being breech. A breech pregnancy occurs when the baby is positioned head up in the woman's uterus, so the feet are pointed toward the birth canal. There are some types of breech baby. Number 1. Frank breech. The baby's buttocks are aimed at the vaginal canal with its legs sticking straight up in front of their body and the feet near their head. Number 2. Complete breech. The baby's buttocks are pointing downward and both the hips and the knees are flexed, folded under themselves. Footling breech. One or both of the baby's feet point downward and will deliver before the rest of their body. Transverse lie. This is the form of breech presentation where your baby is positioned horizontally across your uterus instead of vertically. This would make the shoulder enter the vagina first. What are the causes of breech pregnancy? With all types of breech pregnancies, the baby is positioned with its bottom towards the birth canal instead of the head. Doctors can't say exactly why breech pregnancies occur, but according to the American Pregnancy Association, there are many different reasons why a baby might position itself the wrong way in the womb, including Number 1. If a woman has had several pregnancies. In this case, some of the babies may not be turned into its original position or they are breech. If a woman has had a premature birth in the past, so the history of baby can affect the upcoming baby and the breech position. If the uterus has too much or too little amniotic fluid, meaning the baby has extra room to move around or not enough fluid to move around. Here are 2 types. For example, oligohydramnios is when you have too little amniotic fluid. Amniotic fluid is the fluid that surrounds your baby in your uterus or womb. It's very important for your baby's development. Second is polyhydramnios, is where there is too much amniotic fluid around the baby during pregnancy. Amniotic fluid is the fluid that surrounds your baby in the womb. Too much amniotic fluid is normally spotted during a checkup in the later stages of pregnancy. You are expecting multiples like twins or more. This makes it harder for each baby to get into the right position. The uterus is not normal in shape or has abnormal growth such as fibroids. Most of the time, the uterus is shaped like an upside-down pear. If it's shaped differently, there might not be enough room for a full-grown baby to move into position. The placenta covers all of the part of the cervix. A condition called placenta previa may be the cause of breech baby. The baby is preterm. This means that they are less than 37-week gestation and may not turn to a head-first position. Cause can be a lax uterus, usually associated with high maternal parity. Muscles. After menopause or childbirth, the ligaments support the uterus can become lax or weakened. As a result, the uterus falls in a backward or tripped position. So in this case, baby can be breech. Uterine anomalies like biconjugate or septate uterus. A biconjugate uterus is a uterine malformation that is produced due to impairment in the fusion of Mullerian duct. The biconjugate uterus is a rare anomaly, but it is associated with worse reproductive outcomes and breech position. A woman with a septate uterus has a normal-shaped uterus with a wall of tissues creating 2 cavities. So, these 2 cavities cannot allow the baby to fix his head down into the position. Abnormal pelvic brim. It means that the brim of pelvic is not allowing your baby to fix his head in the normal position. If mother is smoking too much, then it can be a cause of breech baby. If mother is suffering from diabetes or gestational diabetes, that it can be the cause of breech position in the baby. Fetal malformation like hydrocephalus. Hydrocephalus is an abnormal build-up of fluid in the ventricles deep within the brain. The excess fluid causes the ventricles to widen, putting pressure on the brain's tissues. cerebrospinal fluid or CSF is the clear, colorless fluid that protects and cushions the brain and spine. So, this problem can also forbid baby to fix its head into the pelvic area. Low birth weight of a baby is also the cause of breech baby. If your baby was died in the uterus, then the situation is called intrauterine fetal death. So, in this case, baby can also not fix its head. Uterine and pelvic tumor can also forbid the baby to fix into the exact position that is required for normal delivery. Another reason of breech baby is the laziness of the mom. Some women think that they should do rest all the time during pregnancy, but this can cause the position of baby in danger because no movement can affect the movement of baby also. And note is that there are more than these reasons also. For example, sudden shock, accident, or any exceptional case can also be the cause of breech baby. So, there are not certain limits of causes of breech baby. Now, the question is that can you turn a breech pregnancy? So what should you do if you have a breech pregnancy? While you will most likely have to talk with your doctor and scheduling a cesarean, there are also ways you can try to turn your baby. Success rates for turning a breech pregnancy depend on the reason your baby is breech, but as long as you try a safe method, there is no harm. Number 1. External version. An external version is a procedure in which your doctor will try to manually turn your baby into the correct position by manipulating the baby with their hands through your stomach. According to the American College of Obstetricians and Gynecologists, most doctors will suggest an EV between 36 and 38 weeks of pregnancy. The procedure is usually performed in the hospital. It requires 2 people to perform and the baby will be monitored the entire time of any complications that might require delivering the baby. Essential oils. Some mothers claim to have had success using an essential oil like peppermint oil on their stomachs to stimulate the baby to turn on its own. As always, however, with your doctor before using essential oils, so some are not safe for pregnant women. Inversion. Another popular method for women with breech babies is inverting their bodies to encourage the baby to flex. Women use different methods like standing on their hands in a swimming pool, propping up their hips with pillows, or even using the stairs to help elevate their pelvis. So these are the 20 causes of breech baby presentation. Hope you have found the video useful. Like it, share it, and also subscribe our channel for such a useful information we will bring for you.